Is this an epidemic that we're talking about here?
Well, it certainly feels like that. Here we are again. I mean, if you think about it, the numbers keep climbing. And since the early actually since 2000 and up, it's actually gone up about 40–50%. So it's been climbing steadily. I started in 1985, and we didn't treat it like this at all. This is an American phenomenon. So everyone is stressed. All the anxiety, I mean, people feel it last thing before they go to bed, first thing in the morning, right? You feel it.
Sure.
That tension, the achievement, the multitask, the technology, all of that is adding up. And guess what? It's affecting performance at school. And I think it's really teachers that are sort of the frontline diagnosers, and they're not supposed to be. That's where this is coming from. It's usually around kindergarten or first grade, and it's mostly boys.
What about parents? How do we play a role in all of this?
Well, I think the parents could do a really terrific job by really preparing their youngest kids when they go from home to school. And I think we'd be seeing a lot less ADHD in the clinics, teaching them the basics, common sense, eye contact, repeat things back to me, give them a reward for being attentive, because otherwise they go from an environment where they're not asked to attend, where there's a lot of screens and a lot of distractions, to one where all of a sudden they have to perform. But I think also parents really have to seriously look at, is sleep good? Is eating good? Are kids getting outdoors enough? It turns out that those three things may in fact be related to higher rates of ADHD being diagnosed. The medication is unfortunately the first place that people start, and it should be the absolute last place they end up. They should do some testing. They should watch these kids over the years. They should see if whether or not there might be a subtle learning challenge that some testing could figure out. They may have a hearing or a language issue. They may have a vision problem. They may be exposed to lead paint. There's a host of things like allergies, even things like having preservatives in food seems to be related to hyperactivity and these types of problems. So if you stretch out the diagnostic process, take your time, and then a child is still having a lot of trouble, then by all means, maybe a trial of medication can work. But in the interim, there's just good, standard, really intelligent, common sense things that people can do just to make kids fit better in classrooms, which is where this is really happening.
It's amazing. There's quite a checklist before you even get to that diagnosis.
Yeah, absolutely. No, in fact, the list of things that people are now correlating to ADHD symptoms, it just keeps on growing.
Interesting. We're going to have to leave it at that. Pediatric psychologist and author, Dr. Anthony Rayo. Appreciate your time and insight as always.
Great. Thanks a lot for having me.
Thank you.